Hello, this is Paul Barr, Senior Writer for Hospitals and Health Networks. Today I'm with John Turner, Vice President of Orthopaedics for Bon Secours, Virginia, and Overseer of a bundled payment initiative for the parent organization Bon Secours Health System. I'm also with Lauren McDevitt, Administrative Director for the parent Bon Secours System. John and Lauren will be talking about their experiences in managing bundled payments within a CMS initiative. Thank you for being with us here today. John, what are you doing with bundled payments?
Well, right now we're participating in the bundled through the CMS pilot program. About 2 years ago when healthcare reform came in, we had an opportunity to work with the pilot program. So we implemented the total joint replacement pilot, and we began that in January 2015, the implementation phase. That was after the application. So we're right now full in implementation, so we're working through it. And reason why we got into it, we felt this is the future. Bundle's going to be both commercial, it's going to be with CMS. We felt we would have opportunity to help develop policy with CMS. We've had discussions with them. We have been able to do that. We've been able to influence the waivers, which is critical in making this successful. So we see this as the future, and it's really either get on the train or it's going to leave you, and you're going to be left behind, and you're going to have a hard time catching up as it leaves the station and this thing works through. So we're having a good experience with it. It is difficult. It is hard to do. It's a challenge. But there's a lot that we put in place in the last couple of years that we feel that we're being successful with it.
Do you have anything you want to add to that, Lauren?
Well, in terms of getting into the bundle, of course, it's all about our patients. We're excited that it gives us the opportunity as a facility to go beyond those 2.7 days we usually keep those patients to 90 days. So we're excited about the opportunity to follow their care throughout their recovery and work with all the other healthcare providers that provide the care with the rehabilitation of our total hip and knee patients. So we're excited to see that part of their care where before it really wasn't in our purview.
What are some of the interesting features of the bundle payment program?
Specifically, we are focused on the communication between ourselves, the facility, of course the patient being the center of everything, but how we hand off those patients to whether the home care provider, themselves at home, or the skilled nursing facility or inpatient rehab facility. So all throughout their care continuum, we're talking as providers to say, hey, here's what's going on with our patient, here are their goals, here's what we'd like for you to look for. And the handoffs now are always in front of the patient as they go through that care continuum. So that is the biggest component in terms of change for us, is following, handing off, and all of us knowing at all times where that patient is and where they're going.
John, would you want to add anything to that?
No, I think it's a value-based proposition. We've got to reduce the cost for healthcare while increasing the quality. And I think that is what the bundle achieves, and I think we're moving down that road, and I think it's been successful so far.
What kind of results have you seen so far, if any?
Really, we're 6 months into it. We're in our 7th month. I think when we look at the percentages and the qualitative, it's improving. We're still working with the quantitative information, but it's showing some improvement, but we're going to have to continue evaluating that and seeing how those numbers change. I think some of the accounting is a challenge. If you look at healthcare, we're a fee-for-service. We're not set up for a bundled program. So that information is transformational, and I think we can see it qualitatively working, and from the quantitative side we're having some challenges, but we're starting to see that as well.
Did you want to add anything?
On the qualitative side, again, the providers are now talking to each other. The healthcare facility, the SNF, the PAC, we're all working towards best practices for all of our benefit, where before we lived in our silos. So we're excited to learn from the SNF, the home care agency, and the patient on improving the patient's experience through the continuum. The collaboration amongst all of those disparate facilities is what is new for us, and we're all learning from each other, so that gets us really excited.
Are there any plans for you to expand into other procedures or treatments?
Yes, January 2015, Bon Secours is assessing if we want to get into other bundles. Each one of our facilities will undergo an analysis of their top 5, maybe 10 opportunities, and from that we'll engage in more bundles, take the experience we have today, share that with our other facilities, and see if we want to forge into other types of procedures, or stay with hip and knee if we think that's the one that is the most successful and easy to execute.
John, if you had to choose, would there be a particular procedure or area that you would want to expand into?
If you look at our system, I think you've got to stick with something that's got significant volume, probably over 100 procedures. You have to have something that has pretty high variable cost, and that also uses the post-acute care. So if you have that, you have an opportunity to improve, I guess, the cost, because there's significant variable costs where you can bring down. And the post-acute care providers, you're able to shift with those, you're able to put them in the lower cost, but you've got to also increase the quality.
All right, well, thank you very much for being here.
All right, appreciate it.
This is Paul Barr with Hospitals and Health Networks. Thank you for watching.